Live from the SABC's Auckland Park studios, hello and welcome to this week's last episode of the Watchdog. My name is Vuyo Mvogo, and on the show tonight,
Gauteng, we can now say officially that Gauteng has technically exited the fourth wave this week, and all other provinces have reached their peaks. All 8 provinces have reached their peaks.
As statistics show that the country's COVID-19 infections are now on a decline. But it may take almost 2 years to end the state of disaster. Our panel of experts looks at what it all means, while one provincial premier registers his unhappiness with keeping the state of disaster.
We are the people that have had to suffer the consequences of having had to come out to the state capture.
And whistleblowers who testified at the state capture inquiry make their demands known. All that and more coming up in tonight's episode of The Watchdog, which starts now. Health authorities are encouraged by the decline in new infections that is being witnessed across the country, even though the decline is not as steep as was the incline. They are, however, discouraged by vaccine hesitancy, which remains rife, with only 40% of the country's adult population fully vaccinated.
Less than 2 months after South African scientists discovered a new variant of the COVID-19 virus, Omicron, the Health Ministry says most of the provinces have reached their peaks, and Gauteng has officially exited the fourth wave. The country recorded 5,920 cases over the last 24 hours. In the past week, the Western Cape had the highest number of new cases, followed by KwaZulu-Natal.
Gauteng province has officially exited the fourth wave. In terms of the technical definition of a wave, Gauteng, we can now say officially that Gauteng has technically exited the fourth wave this week. And all other provinces have reached their peaks. All 8 provinces have reached their peaks and are now on a decline. Of note is the fact that the decline in new infections is not a steep decline as was the incline. So this virus rises steeply, but when it goes down slowly. But at least it's going down, and this is encouraging.
While Omicron saw less hospitalization, the ministry warns that the variant is still highly transmissible. Government is still trying to reach herd immunity, which could assist in moving the country out of a state of disaster. One of the plans is to drive vaccination. Despite mobile pop-up sites and festive season openings, uptake was still low during the holiday period. Currently, the vaccination rate is still below the target set by government.
Our target is still informed by population immunity or herd immunity, which has to be coverage of between 67 and 70%. So that remains of our target in terms of the adult population coverage, at least 67 minimum and up to 70% of the adult population to be vaccinated. Now, that is why when you look at the preparation in terms of supply and in terms supply of vaccines, how the number of vaccines we acquired through purchasing, and also the capacity which we created to vaccinate the sites, the personnel, and all that is available we could have reached this 70% by the end of December. Where we fell short is in convincing the population to come forward and receive the jab.
Government is also working on new legislation that could see the state of disaster lifted after 22 months.
The Health Department and also Justice and COGTA have been given the task by Cabinet to look at other regulations, largely Health Act regulations under the Health Act, and also any other under the other departments. So there's a team which is almost also finalizing that. We will be going to NCCC and Cabinet in the coming week or in the next 7 days, we should be able to report and make proposals.
Scientists also warn that a fifth wave with new mutations could be expected in the winter months. This will tell if the country is moving from a pandemic to an endemic. Hasina Gori, SABC News, Johannesburg.
Well, for some insights and to help us make sense of all the moving parts, let's welcome Wits University Vaccinology Professor Shabir Mahdi and medical practitioner and activist Dr. Fundile Nyati. Good evening to both of you, gentlemen, and thank you so much for agreeing to come on the program this evening.
Good evening.
Good evening. Thank you for having us.
Well, I couldn't think of a better way, perhaps, to start this conversation than to look at the latest numbers released more than an hour ago. The COVID-19 positivity rate has dropped further to 13% after 5,244 new cases were recorded in the last reporting cycle. The number of active cases in the country has also decreased significantly since last month and now stands at just over 100,000. Now, according to the Department of Health, another 128 COVID-19 related deaths have been confirmed, of which 59 occurred in the last 24 to 48 hours, which brings the total number of fatalities since the beginning of the pandemic in South Africa to 93,117. Perhaps that's where we should start, Professor Mahdi. What are those the latest numbers telling us on the back, of course, of what the minister told us this morning about the decline in new infections being witnessed across the country?
So what these data tell us, as well as experience over the past 6 to 8 weeks, is that this has been a very different experience compared to the 3 earlier waves that have transpired in South Africa. If you take Gauteng as an example, of all of the people that have died of COVID-19 since the start of the pandemic, this wave only contributed to less than 5% of those cases, compared to the Delta variant wave that contributed to 50% of all of the deaths that occurred since the start of the pandemic. So what we're seeing happening is that despite large number of infections having transpired during the course of the Omicron wave, we're seeing a complete decoupling of infections and severe disease and death. So these infections are no longer progressing to severe disease and death. And the main driver behind that is not because the virus is necessarily less virulent, less able to cause severe disease, but rather because of extensive immunity that has arisen across the population, across South Africa. So when the minister speaks about 70% immunity, in fact, we're already at 70% immunity in the country, including in Gauteng. We did a survey where we test for antibodies as evidence of past infection or vaccination. And what we showed, as an example, in people above the age of 50 who are most likely to end up in hospital and die, we showed that in unvaccinated people, 69% of them have previously been infected to the virus and they've got immunity, they've got protection against severe disease. And if people were vaccinated, 93% of them were seropositive. So essentially where we are in South Africa, the reason for this very different experience for the Omicron wave is extensive amount of immunity, and that immunity is vaccine as well as natural infection induced. It doesn't work too well in protecting against infection, unfortunately, against Omicron, but it works extremely well in protecting against severe disease and death. So we're in a very different phase of this pandemic, what I would term as being in a convalescent phase of this pandemic. We're not out of the pandemic, but we're very much in a different phase compared with where we were at least 6 months ago.
Which, Dr. Nyati, becomes important in all the conversations that we're having, that we need to keep reinforcing the messages around what the things that have actually brought us here.
You're very right, Vuyo. You're very right. We are where we are as a result of many things that we had to do. People nowadays, when they see the numbers going down, then they hear the minister saying, Gauteng is no longer in the 4th wave, for example, then they think somehow this pandemic is gone. But it is not gone. the infection is still there, the virus is still there, it's still mutating, so it is so important to reinforce the non-pharmacological or pharmaceutical, messages, that help people to take control in minimizing the chances of being infected or spreading infection to others. So it is still so important. But even more important is what, you mentioned earlier, the issue of vaccination. It is very, very important. I mean, South Africans, we are lucky as a country to be able to have access to these much needed vaccines. It's actually a shame when many other countries in the continent, would love to have access to what we have, and we just choose not to come forward and get vaccinated. Yes, there are many reasons to that. Fear of side effects, issues of mistrust of pharmaceuticals, issues of mistrust of government. But also, other people are questioning effectiveness. But there's enough information, that actually shows that these things do work. Not even one person has died out of these vaccines to date. So the point I'm trying to make is that we need to continue to emphasize the need for people to do the right thing, both in terms of coming forward for vaccination, coming forward for the boosters, those who already did vaccinate, but also practicing the non-pharmaceutical, measures to protect themselves and to protect others.
In other words, Prof, what Dr. Nyati has just said, we can't be reckless because the decline we are seeing today may not last as long as we would want it to.
Well, we certainly can't be complacent, but we need to acknowledge that we are in a very different phase of this pandemic. And yes, we will experience new variants and there will be another resurgence, but it is extremely, extremely unlikely that we will again experience anything that we experienced during the course of the first 3 waves. If anything, the number of people that will end up in hospital and die of COVID-19 is going to become even less after the Omicron wave, where even a greater amount of immunity has been induced. So we need to recalibrate the manner that we approach the pandemic. The pandemic has not gone away. COVID-19 is going to be with us for the rest of our lifetimes. This virus is not going to go away. We're still going to be experiencing people dying of COVID-19 in 10 years from now. That is not going to change. But the magnitude of number of people that are going to die and end up in hospital is going to change, partly because of vaccines, but also partly because of natural infection-induced immunity, and we cannot dismiss that. And what the net result of that is, we can't continue to have policies in place and regulations in place that are completely obsolete, that might have been required at this point in time, but certainly are not required at this point in time. And a classical example of that is the ongoing rotation within schools, absolutely unnecessary. And in fact, it only does harm. It does got absolutely no benefit, either to learners or teachers, not to have schools completely reopened. So we need to recalibrate because we're in a different phase of this pandemic, thankfully, because of immunity. But that immunity in South Africa has come at the cost of a huge number of loss of life. It's not 93,000 people that have died of COVID-19 in South Africa. The number of people that have died of COVID-19 in South Africa is 290,000, based on the Medical Research Council estimates using excess mortality. So yes, we've got extensive immunity now, but it has come at a cost, and it could have been avoided had we been more efficient with our vaccine rollout, and further suffering can be avoided by people doing the responsible thing and get vaccinated.
And Prof, we're going to get into some of the areas you've mentioned, the obsolete regulations, you call them, as well as the vaccine rollout. But before we get there, Dr. Nyati, just from your observations, from the conversations you are having, as medical practitioners, but also, as someone who mixes with a lot of people across the social strata, what is the sense that you are getting from people who have attitudes changed? What are they, attributing, the phase, if I may call it that, we are in right now, and the fact that things have not been as debilitating as they have been, as they were initially?
Well, I think you're asking in the circles, or in the interactions that I have with various people, even already from December, there was a lot of anxiety that maybe there would be stricter, regulations, that is a lifting of the lockdown, level. And so there was a lot of happiness when things were not changed, because people needed to have less restrictions in terms of their day-to-day lives. So I think what one is then hearing now is that, is it still necessary to continue to have the lockdowns? Because obviously under the Disaster Management Act, it then, empowers the president to actually, form that committee that comes up with regulations, led by a minister, and they come up with all sorts of regulations which really affect our, rights as the Constitution. So there's a lot of edginess now, from people to say, can't this thing just come to an end? Because we really need our freedoms, freedom of movement, freedom of association, all of the freedoms that are enshrined in our Constitution. But obviously, I think after 22 months, we can just, cut that. And I'm happy to hear from the minister earlier today that actually there is, a process underway to look at how to amend, certain existing laws to take care of the management of this pandemic, and we will know soon enough, 7 days from now, what they have up their sleeves. So I think there is willingness to get things, less restricted. However, it needs to be done very cautiously. We don't want to go back to where we were.
Prof, which then brings me to the issue of regulations. Both of you have actually touched on that, and one of the people I'm going to bring in a short while is opposed to the continued to us continuing with the state of disaster. What for you are some of the obsolete regulations, as you call them, that are still in place, and how do they make it difficult, for lack of a better description, to actually manage this pandemic a lot more efficiently?
Yeah, so based on where we are, in fact, it's easier to answer which of the regulations are still required, because everything else is pretty much not required. And the only thing that's really required is to have some control about indoor gatherings, especially indoor gatherings in poorly ventilated spaces, and insisting that people that attend those sort of gatherings wear masks if needed, and ideally they should be vaccinated. And that's pretty much the only regulation that we still need in place. Everything else is pretty much obsolete. Pretending that we achieve anything by people wearing a face mask, as an example, when they're running on a beach or playing on a beach, is completely being agnostic to the reality and to the science. Hand hygiene is important. It's important not to get diarrheal disease, but it's not important when it comes to preventing COVID. Doing thermal screening when you're going to schools and shopping malls, completely useless. It's a futile exercise. So the state of disaster is no longer needed. We're in a different phase of this pandemic. We do need some regulations. Those regulations can be encompassed by the department, by government itself through other means, but certainly given where we are right now and what we've observed with the Omicron wave, there's pretty much zero reason to continue a state of disaster. And as quickly as government implemented the state of disaster, I see very little reason why it can't also get rid of the state of disaster equally so, because we need greater oversight of the type of decisions that are made by government, not just with COVID-19, but everything else as well, which eventually impacts on the livelihoods of people.
Dr. Nyati, would that be your sense as well?
Well, look, I agree with Prof with regards to the fact that there certainly needs to be a review of, the regulations under this, Disaster, Management Act 57 of 2002. Maybe the difference here is, for me, I feel that it needs to be well thought through. Different people, different stakeholders must participate in that process to evaluate what's obsolete and what still needs to be kept in place. Otherwise, yes, I agree by and large with what the Prof is saying.
Okay, we're going to take a quick ad break before we bring onto the conversation for a brief moment. A premier says continuing with the state of disaster actually spells disaster for the economy of his province. Of course, both Professor Madi and Dr. Nyati are staying with us throughout the conversation. Welcome back. Cooperative Governance Minister Dr. Nkosazana Dlamini Zuma this morning extended the state of disaster by another month. It was due to expire tomorrow. Now, one person hugely disappointed is Western Cape Premier Alan Winde, who has been fervently calling for an end to the state of disaster. He joins us now via Zoom from Cape Town. Good evening, Premier. Thank you very much for your time. I mean, the basis of your argument has always been that an end to the state of disaster would help save both lives and jobs. Interestingly, the Department of Cooperative Governance is making the exact same argument. Their statement released this morning reads in part, the extension takes into account the need to continue augmenting the existing legislation and contingency arrangements undertaken by organs of state and other role players to mitigate against the impact of the disaster on lives and on livelihoods. Where do you differ?
So, I mean, I think every time we make a decision like this, we must base it on the data. We must base it on the evidence. And quite frankly, in this fourth wave of Omicron, if I have a look at the data on infections versus hospitalizations and deaths, where we are in the wave of the pandemic, and considering the reduction in numbers of cases and specifically cases arriving in hospitals and people needing ICU care. We need disaster declarations and we need these restrictions to protect our frontline, to protect our health system and to save lives. I absolutely agree with that. I think right now, we have now beyond that. It's now more of an endemic instead of a pandemic situation that we're dealing with. I think the consequences, if we just see some of the studies that came out already last year based on the impact of schools, and we've still got this 1 meter rule in our schools as part of the disaster declaration, the long-term impact on the youth and the education standards for our young people is catastrophic. It's going to take years to correct. We need to get rid of it right now. And quite frankly, in our province, I lose more people every day to gang violence. I lose more people to crashes on our road systems than to COVID-19. And, it does not make sense to me at all. We need to end the disaster. We need to get to the stage where it becomes the norm. I agree absolutely with what Prof. Madi was saying. We might need regulation on indoors and ventilation. I think mask wearing should be absolutely up to the individual concerned. We need individual responsibilities. If you're at risk, you will wear a mask. And I think into the future, if you get a scratchy throat, you'll wear a mask. For us, tuberculosis, you should be wearing a mask. But it shouldn't be legislated for everybody. It's not legislated for our dentists, our nurses, and our doctors. They wear masks because it's the right thing to do in the environment that they're in. Citizens will do exactly the same thing. So we need to end this disaster now. The pandemic of poverty is way worse than where we are right now with COVID-19.
Well, from what the Minister of Health said this morning, which we had in that insert that we played, the Health Department, the Justice and Cooperative Governance Departments have all been tasked to look at other acts and develop proposals that he said would then be presented to the National Coronavirus Command Council within 7 days. Does that not address your concerns?
I'm sorry. I started raising this in October last year, saying that we need to start building that pathway so that we build trigger points in. We've done it already. You have trigger points that affect changes. We need to build a pathway in. I said that in October. I must say that quite often in these meetings, I don't always agree with the Minister of COPTA, but in a meeting in December where she said that we need to end the pandemic declaration, the disaster declaration. We need to build this pathway out, and we must start changing the regulation now. I said, Minister, I absolutely support you in this. Let's do it. I mean, here we are a month later. Have we even put one draft regulation on the table? No. It is just not good enough.
Well, I mean, I do remember that in October you also wrote to the president, requesting a consultation with provinces before any extension of the national state of disaster. You also called for a roadmap, as you call it, to end the national state of disaster. What were the responses, if you ever got any?
So, I mean, I've done a few things. I've also asked that can we have representation on the committees that were put in place or said to be put in place. They would have been in November to start looking at it. Well, I've written the letters. I haven't got any answer back to say we'll be on those committees. We are never consulted when it comes to the extension of the disaster declaration. What we do get consulted with if there's a change in the level, the lockdown level. So we were consulted as provinces when in the middle of the festive season, when we actually did away with the curfew. We were consulted then. Even in that meeting, I said, President, I think you should go further than just ending the curfew. You should end the disaster declaration, give a clear signal. And of course, those things that need to be corrected, like ventilation, and maybe how do we get ventilation rules in place, and how do we have indoor gathering numbers with ventilation? We've got between now and probably April to get that right, because in April, May, as we go into our winter season, we're probably going to go into the fifth wave. I mean, there's no reason why it should just end altogether. Hopefully, it's a very slight wave, and we must learn from other cases that we've had even in our own country. I mean, if I look at our own province and the difference in waves depending on whether you're in the West Coast, the Garden Route, or parts of the city. I mean, Khayelitsha itself is something I think we need to do a lot more studying on. We had a severe first wave. We had very flat second, third, and even fourth waves.
Okay, Premier, that we're going to leave it there with you. Thank you very much for talking to us this evening. Of course, both Dr. Nyati and Professor Madi are still with us. And I'm going to throw this at you first, Prof. The agility of both the coronavirus council, command council, and cabinet in dealing speedily and efficiently with these things. I wonder if you have any comment on that.
Well, if they were agile, we wouldn't be sitting where we are sitting with regulations that are obsolete. And I think that is the bottom line. Schools would be fully reopened. If they were actually aggressive, if they were actually keeping up with the science and making the decisions based on the actual data. As the Premier pointed out, we're in a very different phase of this pandemic. More people are going to die of motor vehicle accidents in the next month than are going to die of COVID-19. Yet we're putting restrictions on schooling, and we have still got a whole lot of other restrictions that are in place which don't add any value with regard to limiting the spread of the virus. We're probably going to experience another resurgence in another 4 to 5 months. That's probably almost a given. It might be a different variant, but again, it's extremely, extremely unlikely, given the extensive amount of immunity that has evolved in the community in South Africa, that any future variant is going to be as severe as to what we experienced in the initial 3 waves. If it is, that means we're dealing with a pandemic on top of a pandemic. Because that would be a very, very different virus than what is circulated. And it's not correct to be waiting for a possibility which might never materialize, because then we might just wait and keep these regulations in place until the next pandemic comes in the next 10 to 20 years.
Dr. Nyati, you seem to be a little more hopeful, or the more hopeful of, the three people, of the three of you. What confused me this morning was, on the one hand, the minister saying that there is this, interdepartmental team that's going to look at, that's been tasked with looking at developing proposals and, offering or coming up with alternatives and that kind of thing. And on the same vein, also saying that government is working on new legislation that could see the state of disaster lifted after 22 months. I couldn't reconcile the two.
Well, I think, we're talking of the state of disaster here, which came into effect sometime in March 2020, right? It's been 22 months of that. There was a purpose, for that act, to be activated, basically, for us to have the state of disaster, because we needed to have an integrated, coordinated, disaster management policy and the regulations thereof to help us deal with what was facing the country. So it is not like people just woke up and came up with, that state of disaster. We also are agreeing that things are not the way they used to be, but we just come out of the fourth wave now. And we're still having people dying. In huge numbers, somewhere between 150 and 200. If you look at the past, in the past week, we still have lots of infections. Up until the 5th of January this year, we were ranging above 11,000 new cases per day. So we can't then, almost say that we are out of the woods. So for me, I really support a cautious approach. Yes, the points that the Prof is making around certain regulations that really don't make sense, and what the Premier is also making in terms of the rotational system in the schooling, all of those things really need to be dropped. But I really still think we need to be cautious, in the approach, because we are not out of the woods, and at the end of the day, the government has a responsibility to make sure that the lives and the livelihoods are balanced. At this moment, they see that the risk on the lives is going down, and they definitely do want to make sure that they open up things so that, the impact on the economy or economic activity can actually be improved. But then, if we're looking at the Premier, remember, at the end of the day, the Premier is also a politician. One of the things that generally, all political organizations have been unhappy about is that this state of disaster limits, their contributions to how things should happen, the oversight by Parliament. I mean, we've had the EFF saying the same, a few days ago. And the fact that it's almost like we're in some form of dictatorship. So I understand that from people who are politicians. But yes, things are getting better. Let's review, let's remove that which is obsolete, but let's be cautious in how we are moving forward. That's all I'm saying. Yes, I'm positive, because I do believe that the people who are actually working on these matters, they actually have got the best interest of the country at large.
Prof, I want to then move to the issue of the vaccine rollout, which you raised. Vaccine hesitancy remains rife from what we know, of course, which the minister, repeated this morning. Only 40% of the adult population is fully vaccinated, far less than what the government aimed or thought we would be by now, which was 70%.
Yeah, so I think, like I mentioned earlier, we already at a 70% threshold with regard to the percentage of the population that have developed immunity. and that is because of a combination of vaccines as well as natural infection. And both of those don't work too well in protecting against infection, but both of those work extremely well in protecting against severe disease. And if people have been previously infected and then they get vaccinated, they even get a better protection, both against infection as well as severe disease. So we already at this 70% threshold, which is really an arbitrary threshold. It's really not any science any longer, which makes it a magic number. It was in a magic number at the start of the pandemic, when we thought that we'd have vaccines that would be able to prevent infections and get to herd immunity. Herd immunity is an obsolete concept. We're not going to get to herd immunity with vaccines. Herd immunity means that no one in the population, or very few people in the population, are susceptible to being infected with the virus. That is not going to materialize. We will do much more in the country with regard to weathering future resurgences by solely focusing, quite frankly, on getting 90% of people above the age of 50 vaccinated. It's not the number of doses of vaccine or the percentage of the population that are vaccinated that's important any longer. What is most important is getting 90% of people above the age of 50 vaccinated. And that will result in COVID-19 probably causing fewer deaths than occurs with seasonal influenza each year before COVID started. Now, I just want to go to numbers game again. Yes, people are going to die of COVID-19. But South Africa has not had a state of disaster for the past 10 years, when 58,000 people have been dying each year because of tuberculosis, and 70,000 people have been dying each year because of HIV. COVID-19 in 2022 is not going to cause anywhere close to 58,000 people to die. So we need to reflect on the numbers, and we need to be honest about where we are, what we're wanting to do, where we are at this point in time compared to 6 months ago, when a state of disaster might have been needed.
Dr. Nyatsi, I mean, the pop-up, stations, partnerships with traditional and other community leaders, spreading, vaccination to cover children as well. In spite of all those things and more, we haven't really been able to get to the kinds or the levels of vaccination that we would have all wanted. But what is your sense? I mean, often we hear, and we heard that again this morning, the government saying, oh, we're not out there enough, our message, is not getting to the people. We should look or devise new strategies of doing exactly that. What from your vantage point is, stopping, this message from being heard?
All right. I think earlier I did mention something about the issue of vaccine hesitancy. The study that was done by UJ together with the HSRC, which looked at what are the issues that make people to be hesitant. And I mean, there were three of them. It was the fear of side effects. It was the question marks around effectiveness or efficacy, and the third one was the issue of mistrust of pharmaceuticals and or government. Now, I still believe in my interactions with people, one of those or more than one of those are the issues that are affecting the ability of the people to come forward. Now, what I think has been a challenge, I think, is that one, the people who are hesitant, who have genuine questions or genuine concerns, at times we were dismissive. When I say we, those who are supposed to be, helping with the messaging, sometimes were dismissive. So the need to really listen to the concerns, explain, give the right information. It's not the first time we have a pandemic and where there are certain things that people need to do, but they don't do them because the information is not coming to them in the language that they understand, in a way that addresses them, makes them feel heard. So we have to go back and say, what were the things that worked during the HIV, at the peak of the HIV pandemic? when we were saying, people must go and test VCT or voluntary counseling and testing, and people were not coming through. We had to change things. We needed to get people in the communities that are trusted, peer educators in workplaces, use of traditional healers, use of traditional leaders, and all of those kind of things. So it is important that we go back to some of those things that did work at that point, over and above whatever other medical things that needed to be done. So I actually was one of those people who was supportive of this Vuma vaccination drive and the awareness creation linked to it, because I still believe there is not enough information that is getting to people in the language that they understand, whether we're talking vernacular language or the level of English that is being used for people to understand why they need to do what they need to do. So the point I'm trying to make then is that, again, I think we must learn from things that worked in the past. There is an NGO that's based in Cape Town. Already by June, July last year, they were saying the same things, lessons from HIV and AIDS, and also lessons from TB, management. And this is what we need to also look at, more especially that this COVID-19 is still going to be with us for quite some time. So let's actually do get to a community mobilization level and use the people at that level who are obviously informed, have been well trained, so that they can be able to help, with bridging the gap that makes people anxious and people opting not to take up these vaccines.
Last word from you, Prof. I've just remember that you, in fact, led that clinical study for the AstraZeneca COVID-19 vaccine. And that's where, of course, you spoke, numerous times about, apathy and hesitancy because of the information you got from that study. Given the fact that we seem to be, or we could, in fact, see a fifth wave, as people are telling us, around the winter months. What should South Africans watching this program be taking out of this conversation?
Yeah, like I said, it's really important, even if you've been previously infected, to still to be vaccinated. And a large percentage of the population have been previously infected, but you can enhance your protection against COVID-19, and including severe disease, by getting vaccinated. I fully agree. Unfortunately, we haven't been too good with our messaging to the public. And I think that at the end of the day, we need to understand that vaccines are there to save lives. They're not there to harm people. Vaccines have done a tremendous job in the past and continue doing a tremendous job in saving lives from many conditions, especially in children. And this time around, it is adults that actually require the vaccines the most. And those adults that choose not to be vaccinated, they're not just shortchanging themselves, but they also pose a burden on the rest of society, because when people end up in hospitals and end up in ICUs, in the public sector as an example, that costs the fiscus close on to 20,000 rand. And what we've seen recently is 85% of people that end up in ICUs are people that have not been vaccinated or inadequately vaccinated. So vaccination is absolutely an important component of moving forward, of being able to get back to a relatively normal lifestyle, and particularly the vaccination of people above the age of 50.
And that's where we're going to leave it this evening. Special thanks to both of you, Wits University Vaccinology Professor Shabir Madi and medical practitioner and activist Dr. Fundile Nyati. To this story now. Whistleblowers who testified at the Zondo inquiry into state capture say if recommendations on whistleblowing are implemented, it would stem the tide of delegitimizing the state. They were responding to the release of Part 1 of the Commission's report, which recommended the establishment of an anti-corruption agency, but they say it should also include the office of the whistleblower.
Well, whistleblowers say there is still too much lip service when it comes to the strengthening of legal protection and institutional framework for whistleblowers.
The pace is very slow. During his evidence at the State Capture Commission, the state president did allude to the protection of whistleblowers. Since then, what has been done to protect the whistleblowers? Babita Diakaran had to lose her life. There are a lot more other whistleblowers who are still outside. We know of witnesses who could not even be named. Take the Transnet witness, who was one of the bodyguards, whose life was almost taken away, who is still out in hiding. You know, how long ago did Transnet, that particular whistleblower, give that evidence? It's a while ago. We have pledged, we have requested that it not just be a talk shop, that something be done. It is not within our hands. We are the people that have had to suffer the consequences of having had to come out to the state capture and obviously is subject to subpoenas. You know, it was not, in some instances, yes, it was voluntary. In some instances, we were subpoenaed to come forward. And had it not been for the state capture, would our lives be what they are today? You know, I mean, in terms of where the state is and what is being done as far as, you know, making sure that the whistleblowers are protected, how often have you spoken about this? What is being done to date?
But they've welcomed the recommendation in the release of the first part of Zondo's report on the establishment of an anti-corruption agency.
We further believe that such an agency should be independent and impartial and subject only to its mandate, the law of this land and the Constitution. Thus, we concur with Acting Chief Justice Zondo. We believe that this agency should have a division called the Office of the Whistleblower. This office must be adequately resourced with the necessary skill to ensure legal protection and social, psychological, and even health resources for whistleblowers.
Whistleblowers are calling for fundamental reforms to the Protected Disclosures Act. This includes compensation, to introduce an expanded list of persons to whom a whistleblower may make disclosure to. There should be a legal obligation to ensure confidentiality, and that the South African legislation be in line with that of the United Nations Convention Against Corruption, which provides for the physical protection of such persons.
And if that is not done, the whistleblowers say they're willing to go to court. Crisalda Lewis, SABC News in Johannesburg.
Well, Martina de la Tonia, one of the whistleblowers you saw in that insert, now joins us on the line to just give us some insights or clarity on some of the things that they are raising. Martina, good evening. Thank you very much for your time. I was looking at the reforms that you are suggesting, and thought perhaps I should ask someone like you to expand a little on them and what they will mean to the whistleblowers who came forward, but of course, I mean, a future dispensation, you know, that will protect whistleblowers a lot better than is the case at the moment. You are asking for the South African legislation to be in line with that of the United Nations Convention Against Corruption, which you say provides for physical protection of such persons. Expand a little on that and why it is so important. Please unmute yourself.
Apologies.
Okay,
and good
no
evening
worries.
for your...
Yes, we can hear you now.
Okay, great. Good evening to you and the listeners, and thank you for tackling this important subject. Look, we've had experience in this country, especially in the last 5 to 10 years, of whistleblowers coming forward, being threatened. As recently as late last year, Babita Deokadan was assassinated brutally for blowing the whistle and being a state witness to corruption. So whistleblowers feel threatened. Whistleblowers are isolated often. If you're trying to do the right thing, if you're just an ordinary official of the state or even within the private sector that's trying to correct a wrong and follow your conscience, you threaten the corruption pipeline. And as such, we've had plenty of examples of whistleblowers and citizens with conscience being targeted, whether it's through your reputation being damaged, your financial resources being drained, and your very security and that of your family threatened. So I think these are very important recommendations. We're not talking about reform, we're talking about an entire review of the Protected Disclosures Act and related legislation and systems that need to be put in place. I believe this country owes a debt of gratitude to the whistleblowers who have come forward to release and unveil the extent of the corruption. And no state entity has been left untouched. And frankly, the private sector is very much responsible for the damage done to our country. So that's what we stand for, Vuyo.
And confidentiality, why is that very important?
It's not always safe to blow the whistle. It's not always safe. And I think every person is entitled to confidentiality. And at the same time, it's often the case that whistleblowers are revealed, that whistleblowers are their identities revealed without their permission, and that puts them also at risk. You've got the example of Ethel Williams, who's felt the need to leave the country because he just feels that he hasn't been given the kind of protection he needs, despite the kind of role he's played in uncovering the corruption at Bain. And there are many Bains in this country that need to actually be dealt with. So yes, confidentiality is critical to preserve the integrity. I mean, it's not that we wanted as whistleblowers to come out in the public domain and reveal ourselves. It's just by force that we've had to do so. And it's very good that we're now a group that are able to work together collaboratively to lobby for the kind of legislative change that needs to happen to future-proof this country.
And the issue of compensation is often controversial. You often hear people saying, "Oh, now you want to cash in," and just why that is so important.
When you lose your job, when you're suspended, when your matter goes into the public domain, your career is essentially threatened, and many of us continue to either be unemployed or having to revise our entire kind of lifestyle because of the kinds of acts of conscience we have made and the consequences thereof. An important distinction, though, and this is where we differ from one of the Zondo Commission recommendations. The Commission report, or at least the first report, is suggesting that we follow the kind of the bounty hunter approach, which is whistleblowers get a percentage of the revenue that is returned after a successful case. We feel strongly that this would create a culture of bounty hunting, and that's not something that we are keen to do. What we feel is that it's important to have to be compensated for the loss of your income. And, many of us have lost houses, our families have suffered. In fact, I really need to acknowledge the role of families of whistleblowers in here, because they are the collateral damage of our acts of conscience. And sometimes it's hard for families to understand kind of the real severe lifestyle changes that happen as a result of whistleblowing. An important element is also the psychosocial support that's needed for whistleblowers who are putting themselves on a limb. But the common denominator in all of our actions has been we are driven by issues of principle, issues of conscience. We've done what we've needed to do because our very constitution was being violated. And so we remain convinced that we shouldn't be compensated unnecessarily. We should really just, that whistleblowers should be protected at the level of financial resources in compensation for what has been lost.
Martina, let me thank you very much for your time this evening and for really clarifying those very important issues that are part of the recommendations and the fundamental reforms you believe are needed to the Protected Disclosures Act. Martina de la Tonia, who is part of a group of whistleblowers who today came forward to, one, respond to the first volume, to part 1 of the state capture inquiry report, but to also, comment on some of the recommendations that the inquiry Judge Zondo and his team have actually made. I'm sure we haven't heard the last of this particular issue. The conversation is going to continue as the rest of the report gets to be released and published. And that's our show for tonight and for this week. To join us again on Monday, 8 p.m. sharp. Have a good night and a great weekend.